There may be situations where you need to pause or stop treatment delivery to attend to the patient. A more serious situation can also occur when the source wire does not properly retract into the safe, either because of kinks in the applicator channel or a mechanical electronics failure of the unit. The authorized user physician and authorized medical physicist shall follow these steps to safely manage the situation.
When there's an emergency situation, we first try to click the interrupt button. When the interrupt button fails to retract the source, then we press the E-off button on the console. As an alternative, you could also press the E-off button on the wall.
Emergency off buttons can be reactivated up to 2 times if the first attempt fails.
If the E-off button failed retracting the source, we'll need to grab the survey meter and the emergency stopwatch. And then have the door half open. As we enter the room, we need to start the stopwatch.
As you enter the room, look for the Afterloader stop button, which is on the back of the Afterloader, and push that button.
If the Afterloader stop button failed to retrieve the source, we're going to manually retract the source using the hand crank.
There is an arrow that points the direction of the crank that you have to turn.
Once the applicator is removed from the patient,
Applicators and the transfer guide tube may be placed into the emergency container. However, this section may not be always visible due to the number of channels, applicator size, and shape. You should focus on removal of the applicator from the patient, and if you cannot fit those applicators into the emergency container, that's okay.
make sure the Afterloader is moved to the corner of the room and take the patient away from the source. Then we're going to use the survey meter to carefully survey the patients to make sure the source is outside of the patient. Then we're going to press the door button twice to open the door fully so we can transfer the patient outside the room.
Using your Geiger millimeter counter, survey the patient in the hallway to make sure that there is no trace of radiation inside the patient. In a very unlikely situation where the source is left inside of patient, it must be surgically removed as quickly as possible and stored in the emergency source container. Then you have to block the entry of this room by closing this door completely. A door sign shall be posted to prevent accidental entry into the room. Then you have to contact radiation safety to report the event, and then the vendor, Varian, so that the engineer can come out and address the issue. Attending or referring physician needs to be notified as well if they were not present. Because this is a medical event, radiation safety will report NRC verbally within 24 hours, and then with the written report within 15 days.